I'd like to introduce the next collaborative talk between myself and summer student Kannan Maheswaran, who volunteered for the newly created summer studentship, the Andrew Scadding Summer Studentship, and we established this to honor our most senior trustee, Andrew Scadding. The reason we chose these topics is that both fatigue and pain are very difficult to quantify. And so they're very difficult if you're trying to talk to your doctor about how fatigued or how much pain you have. It's very difficult to pin down how severe this is. However, both of them affect the majority of patients with both Marfan and LDS and impact on their daily lives. So Kannan, who's a UCL medical student, has volunteered because of his interest in statistics to analyze the data that's coming back from our questionnaire survey of our postal list of members. Now, since 2017, we've had 15 UK medical students work as summer students for 6 weeks on a research project of interest to our supporters. The purpose of this project is to establish the incidence of significant pain and fatigue and the impact in the same population of subjects. Can we move the slide on, please? That's it. Thank you, Kannan. Do they co-occur? Perhaps they are just different aspects of the same thing. Perhaps low-grade pain causes fatigue. We need to know what we're dealing with so that we can actually find the best medication. And we're aiming to contribute to a larger European study of fatigue in connective tissue disorders. It similarly affects patients, for example, with Ehlers-Danios syndrome. Our study population of 1,500 individuals from our supporters postal list is different from the commercially analyzed Picker questionnaire, which Joanne Jessup, our research nurse, is sending out at the moment to our email list of supporters. And she'll be talking about this a little later in the program. The demographics, things like where they live, what kind of work they do, and so forth, will be taken from the larger Picker questionnaire later in the summer, because these are two different studies on the same population. Next. When you start any project, you've got to review the literature and see what's already been written. Scientists stand on the shoulders of those who have gone before them and incorporate previous work into their findings. I found 3 papers that were of interest to us. This one from France was titled "The Determinants of Fatigue in Patients with Marfan Syndrome." The method they used was a cross-sectional study in an e-cohort using email of 162 Marfan syndrome patients. Fatigue was measured by a FACEIT questionnaire, which we're not using. We're using a slightly different one. Pain and its interference with daily life was measured by the brief pain inventory, which we are using in our study, so therefore the results will be comparable. Their conclusions were that fatigue is common in Marfan syndrome and is associated with pain that interferes with daily life. Therefore, pain management could improve the quality of life and the degree of fatigue. The second paper was entitled, next slide, Kannan. Who's controlling slides? The next paper is titled Satisfaction with Life in Adults with Marfan Syndrome, Associations with Pain and Fatigue. And this paper came from authors in Norway. Their method, a cross-sectional study, postal questionnaire, just like ours, including satisfaction with life scale, SWLS, a method of determining chronic pain and fatigue. They used the fatigue syndrome questionnaire, which we also used in ours. The results from 72 patients showed that their satisfaction with life score was significantly lower than in the general population. But when they looked for contributing factors in their study, they found that only severe fatigue and psychosocial aspects such as depression and anxiety contributed to this low satisfaction of life. On the next slide, their results showed 47% reported chronic pain, 30% reported significant fatigue, and they try to explain that the reason only 47% reported pain is that as adults, we learn different coping strategies. And the psychologists who are listening to this will know all about this. And these are listed here. You can deny the pain completely. You can compensate, you can repress it, you can suppress it, or you can use projection. So if you were going to seek psychological support for your fatigue or pain, the psychologist would probably want to go in to those methods of coping. The third paper was titled Heritable Connective Tissue Disorders in Childhood. In other words, when did the pain and the fatigue begin? And are they significant? And they found there were indeed. Their aim was to quantify fatigue and pain in Marfan, Loeys-Dietz, Ehlers-Danios, very similar connective tissue disorders with questionnaires. They enrolled 107 children aged 4 to 18, and the results showed significantly higher pain scores and fatigue scores compared to normal age-matched population. Now, next, I'd like to talk about our study. And we use two scales that are generally accepted in studies like this. The fatigue severity scale is quite easy to fill out. The question is, during the past week, I have found that, and then you're asked to put a numerical amount on your motivation and all the rest of these questions. Significantly, number 8 says fatigue is among my 3 most disabling symptoms. And this is an interesting question. So Kannan was given the score of creating a huge database with all these answers and then totaling the fatigue severity scale and seeing if it correlated with the pain scale and if it gave us any clues as to what we're treating. Which comes first, the fatigue or the pain, or do they just coexist? Next. The pain scale I'm not showing in its entirety because it's quite detailed, asking where the pain is, how frequent it is, how severe it is. But Kannan will deal with that. But these questions on the pain questionnaire were especially of interest to us. What treatments or medications are you receiving for your pain? Because by working backward, if you can find out what class of medicines are relieving the pain, you might find out more about the cause. And then 7B, do you use any other medicines which are not recommended by your healthcare professional? Yes or no? And then please tell us what you're using and what you use it for. So our reasoning here was that we might come across some medicines or treatments such as acupuncture, medicines such as cannabis. We had turmeric suggested, things that might give us a clue, again, into new methods of relief of pain and fatigue that perhaps we should be offering to our patients. Now I'm going to hand you over to Kannan, who is a medical student at University College London. He's just returned there after a summer off, but he's very kindly giving up part of his Saturday to come and give us preliminary results. These are not publishable yet, but they may point us in the right direction and allow us to ask intelligent questions and perhaps even questions that you're going to pose yourselves when Kannan's finished with his data. We wanted to get back to the population who had helped us by filling in the questionnaires. And some of you, I'm sure, will be here with us. And in Kannan, actually, can I present my cases first, Kannan? We start with Noah. I've got 3 cases to present. And then come back to your slides. Is that possible?
Yeah.
Can you find them?
Yeah, I have. Oh, first one, Noah, you said?
Oh, actually, no, sorry. We're okay. Go back to the questionnaire then if you want to show us something, and then we'll go to the 3 cases.
Okay, that sounds good. Okay, perfect. So nice to meet you, everyone. I'm Kannan, 15th medical student at UCL. Yeah, so I sort of analyzed the data and collated some of our like initial impressions on what we were seeing in terms of pain and fatigue in Marfan's as well as Loeys-Dietz syndrome. And I'm just going to start with some of the background. So we did get around 123 responses back. 116 were complete, 7 were incomplete, so they might have not answered a few of the questions. 23 patients said have gone away, and unfortunately 2 have passed away. So these were our general responses that we got. And of those responses, 108 patients stated they had Marfan syndrome, 7 patients stated they had Loeys-Dietz syndrome, and 8 did not state which of the conditions that they did have. In terms of sex, which is something that we'll talk about later, 76 patients were female, 45 were male, and 2 did not state whether they were male or female. Okay, so if we quickly go back, the first part of the pain questionnaire was a sort of 6 questions, sort of identifying how severe and where patients mostly felt pain. And this is usually within the last 24 hours because, we want to see on a day-to-day basis, are they really feeling this pain and how severe it is? And we got a lot of good insight into the locations. So a lot of the locations back, and the back was really important. A lot of people had back pain. A lot of the joints, like proximal joints, like the shoulders, the hips and the knees were affected. But some patients also had other things like chest pain, intestinal pain, and things like that, which is also interesting to see. It's just sort of showing how like widespread and different each patient can present with their symptoms. So if we look at the analysis for those results, this is what we saw. So around 55% of patients um, experience mild pain. And this is all patients, usually with at least one form of pain relief. 38% had moderate pain and 13% had severe pain. And when I saw this, it showed me that work still needed to be done because a lot of these patients were maybe a bit older, so they've been living with the condition for decades on multiple forms of pain relief that could whether that be paracetamol or stronger medication, things like that, with things like physio, and they're still experiencing moderate to severe pain. So it does show that there is still a gap that needs to be identified. And the second thing I want to talk about is pain interference. So this is sort of the more subjective and something that I was actually really interested in. So this is sort of looking at how the pain that you do experience with the condition affects your day-to-day life. So general activity, mood, walking, normal work, relations, sleep, and enjoyment of life. And I think this part of the question is actually really telling in terms of like like sort of psychosocial aspects of the condition. So usually like people can go out their day to day, walking, going to work, having relations with other people, sleeping well. But with the condition, it affects of all aspects of your life, not just like physical manifestations that we talked about, like the heart conditions and things like that. And when we do look at that, we did see an increase in the amount of moderate and severe pain interference. So this is the pain significantly affecting their day-to-day lives. And I think this is really important because not only do they have this pain, but it's stopping them from doing other things. And it means that, it could sort of cause like a cycle of like isolation and lack of enjoyment because they've got the pain, they're not able to do activities, which is can cause them to be happy. So now they're not doing that thing they enjoy, which is causing them to become more sad. So it can cause like a vicious cycle. And the fatigue severity scale is something we already talked about. And it's that questionnaire with 9 questions, rated out of 7. And we saw that 61% of patients had severe fatigue. And this is really important because for pain, we can sort of give patients quite a wide array of options. Um, so pain relief, things like that, and physio and strengthening muscles to help with the pain. But with fatigue, there's a bit of a limitation in terms of what we can do and what we actually know about fatigue. It's more of a gray area, and as Dr. Chow talked about earlier, we do think there's some sort of link with pain, but we're not too sure how like that's occurring. And I did some statistical testing, and it was very significant. So it was like less than like 1 in 200 billion uh like probability that occurred due to chance. So we're pretty sure that patients are actually experiencing very severe fatigue. Um, and it's something that I would like to address. And then we calculate these scores and saw how many patients had severe fatigue or severe pain. But we want to see, is there any sort of links between the demographics that we saw and the results we were seeing? So if we talk about pain severity, we do know that as you get older, especially within our population, there's a slight strong link between age and pain severity. So older patients are more likely to experience pain. And this could be for a multitude of reasons. Um, you know, as you get older, your muscles get weaker, means the muscles on your joint are less able to compensate, and it can mean that you do feel that pain. Um, Again, you're less active and things like that when you get older, so you might not be able to actually keep your body up to speed, could causing some pain. It's very multifactorial, but we do see this link. But one thing we did see is that age doesn't significantly affect the pain interference or fatigue. So fatigue was sort of visible at all ages and quite varied from patient to patient, which means that there's nothing that we can actually see that is causing that link between age and fatigue, and it could be something that could help us in the future, maybe looking at different things that say the same between older and young patients with Marfan's. Um, and this is sort of our golden question, something that we really want to get out of this study. Is pain and fatigue linked? And the way I decided to try and see the association is get each individual patient, plot their pain score with their fatigue score, and see if it sort of comes up with a correlation, and it does. So as we see, the patients who have the most pain also have the most fatigue, and we've got quite a strong correlation there, and it's statistically significant. So based on this study, we do completely understand that pain and fatigue are linked, and it's sort of a good stepping stone into the future to sort of understand why they are linked and sort of find out the causal mechanisms of it. And with the questionnaire, especially in the additional information section, we did get a lot of valuable information from patients on how they are treating their pain and fatigue. These are just some of the most common ones that I saw. And you do have a wide range. So some patients take nothing. A lot of patients actually take nothing, and they can cope with the pain. And usually it's older patients who have had it for a longer time. Some patients take just paracetamol, things like that, but other patients are on multiple medications, opiate medication, paracetamol, with some non-medical medication like physiotherapy, heat, and things like that. As we talked about a bit earlier, the use of CBD and cannabis has been talked about a lot more nowadays. It's being approved for a lot of new conditions, and it is something really interesting to look at. Some patients do report that it does help relieve their pain quite significantly. But again, it's not legal in this country. Well, cannabis isn't. CBD is. And it does require a lot more research into not only how the medication would actually help treat the condition, but is it feasible like in the NHS or for patients to afford buying it because it is quite expensive. One thing that I kept seeing again and again is the theme of gentle exercise, and I think that is really important. As the doctor was talking about earlier, even for like the cardiovascular aspect of it and things like that, exercise is always shown to be beneficial. And I'm not thinking just for like the physical and endurance side of things, but also a lot of exercise, getting out of the house, breathing fresh air, things like that, improves your mental health. And I do think that like there's a link between pain and mental health, and it's been shown in a lot of different conditions, and I think it can really be effective in improving mental health, in affecting your pain and fatigue. And touching on that a bit, one patient reported that they go to cognitive behavioral therapy. Me and Dr. Child talked about how, it's very hard to refer patients with the condition to get sort of therapy and treatment, looking at the mental health aspect of it, because it's people might view it as like a primarily like a physical condition, but any chronic condition has been shown to affect mental health negatively. And I think this could be something to look at in the future. So the next steps. So those are just some preliminary results. Hopefully we can refine them over the course of the next few weeks and months. But some things that I want everyone to consider is first thing is I know there's talk earlier about how to treat fatigue and fatigue and chronic condition, but really sort of getting to that point of telling patients this how you can treat fatigue. It's a long road, I know, but it's something that needs to be done because if, as we saw earlier, 61% of patients had severe fatigue, whereas only around 13 to 20% had severe pain. So there's still that mismatch in patients, still have a lot higher levels of fatigue than they do pain. So it's something that we do need to look at. A lot of the patients complained of mental health impacts of their condition. And I do think that there is a link between fatigue and pain with mental health in chronic disease like Marfan's and Loeys-Dietz. But again, mental health services are very like oversubscribed, and it's very long waiting times to actually get that help. So maybe think of like self-help tips and things like that for patients currently, and then looking at further things in the future. Seeing, okay, we some patients are on 4 or 5 medications, but they're still having severe pain. Why is that? Maybe looking into that. Again, that's more of a personalized thing. And in the future, preventative measures. So if we can identify pain, we have a bit of a better idea on, but fatigue especially, what's causing these symptoms and how can we prevent that in patients, especially if you're having kids that have it, what can we put in place for kids to make sure that they don't have these same pain and fatigue symptoms? To conclude, we did find out that pain and fatigue are significantly correlated and they are linked. And even though a lot of patients are given pain relief, we know that pain and fatigue is still significant within that population. There is that vicious cycle of pain and fatigue. And I think there's something to do with that lack of activity. If you're having pain, you're fatigued, you don't really want to go outside, you want to stay at home and rest. But that means you're not, moving your muscles, moving your joints, it can cause your condition to get worse. And I think that's something that we do need to look at. But a lot of patients, especially on that pain questionnaire where they're showing relief, if we go back to this, things like curcumin, the turmeric we talked about earlier, heat, physiotherapy, gentle exercise like yoga, Pilates, and swimming, something about a good diet. So diet is really important in terms of just general health. And again, exercise, CBT, all of these things are showing effect and patients, are experiencing good outcomes with that. There's a lot of work that needs to be done, and I'm excited, to be a part of this and seeing sort of where it goes, in the next few weeks and months and seeing what we can get out of this project. And I just want to say thank you so much for letting me speak. I'm just going to go back to the cases that Dr. wanted to talk about. And we said we'll start with Noah.
Oh, yes. I was impressed as a clinician when I went through these responses to realize that the age range in responders was that of a lifetime. We had some children who were already affected, and I'm going to present Noah as representative of that group. And then we had some older patients over 80 who'd obviously come through their diagnosis and a whole lifetime of living with Marfan syndrome, who didn't have very much pain or fatigue. So I thought this is absolutely fascinating. So I'd just like to present 3 quick cases to show you we have a lot more thinking to do, and to say a big thank you to these patients for allowing me to present them. But Noah, do we have a picture of Noah?
We do. There we go.
There he is. Noah is a delightful 10-year-old. He's the first child in the family to be affected, and he complains of chronic joint pain and chronic fatigue. The fatigue was really affecting him, falling asleep in school, couldn't participate in sports, needed to have an early bed night all the time. And the next, please. That's it. Thank you. His pain questionnaire showed that he had daily pain, and on a score out of 7 on his chart that we asked him to fill in, it was on average 4 out of 10, which is significant. Affects his wrists, hips, and knees, and consequently his writing and his work at school are affected. It affects his mood, his sleep, and his enjoyment of life. And he finds that paracetamol is effective for him. Next. Fatigue. Exercise brings on fatigue. He's easily fatigued. It interferes with his physical functioning and causes frequent problems. And it prevents sustained physical functioning, such as is required if you're playing a ball game at school with teams. Significantly, he thinks it's amongst the 3 most disabling functions, and it interferes with all aspects of life, work, family, social life, schoolwork. Now, Noah is very interested in finding out as much as possible about this condition, and has applied to the Marfan Trust to ask about other children who have this diagnosis. And he's very interested in having a pen pal in England. He lives in Oman, but with his family, but he returns to the UK several times a year to visit family and his doctors who are looking after him. So if anyone has a child about age 10, boys or girls, who's interested in writing to Noah in Oman and sharing symptoms and solutions, he would be very pleased to hear from you if you contact our central office, and then we'll pass on the information to his family. Noah's also been very helpful in that he has been investigated quite thoroughly in many directions, and it was found out at a sleep clinic that he suffers from sleep apnea, and that he had very large tonsils and adenoids. So they removed his adenoids, and they were blocking his airway, and that seemed to be helpful. He's also been offered CPAP, which is continuous positive airway pressure at night, and this keeps the airways open. And so that helps with people who slow down in their breathing or stop temporarily and then pick up again. And that really defines the problem of sleep apnea. But the most worrying effect is that when you wake in the morning, you don't feel as if you've had any sleep at all. It's very unrefreshing. We did try other practical suggestions, like a pillow under the knees at night to reduce pain and gentle stretching exercises. But we also encourage children to find other interests and talents to take the place of sporting activities, which they have trouble with. So because many of our children, especially the boys, are very good at ping pong because of their long arms, we have encouraged Noah to learn how to play ping pong and possibly have a table in his house so that his schoolmates can come and play with him at something that he's good at. He's very talented at maths, so he may well take that further than his class. He loves building models of all kinds. And at school, because of his uncoordinated handwriting, and we find this is a frequent problem because the children have very lax joints, we have suggested that he use an iPad as soon as possible. So now I would like to hear from anybody about age 10 who has Marfan and wants to share symptoms and solutions. Our second patient is Val, who is 85, and we see here with two of her three lovely sons. She has grandchildren, both granddaughters and grandsons, and she's had a very active life. Marfan mainly affects her eyes, and of those people in her family who are affected, eyes tend to be the main problem. Her feet are very painful, which reduces her mobility and her independence. But this is an interesting family because they seem to have mainly eye disease, not heart or skeletal. And they don't seem to have a high incidence of pain or fatigue. So this is interesting. Perhaps if we stand back and look at all our families, those who have predominantly eye disease don't have so much pain or fatigue. And it may depend on where their mutation is in the fibrillin 1 gene. So this would fit in nicely to Jose and his student studies of genotype-phenotype correlation. And we'll enlist him to look at the mutations in our eye families. Next, Val reports that exercise brings on fatigue, but that doesn't bother her because she doesn't do a lot of exercise. It's not among her three most disabling symptoms, and it interferes moderately with her life. So that's the age range, 10 to 85. So this is obviously a lifelong problem. And I feel especially badly about the children who are starting out eating all the energy and all the strength they can muster just to cope with daily life. The third patient is Ian, and he has Loeys-Dietz syndrome. So this told us there are more patients with Loeys-Dietz who answered positively. Tells us that the similarity between the two diseases, Marfan and Loeys-Dietz, continues into the pain and fatigue picture. But he's age 67. His daily pain, he would average at 3 out of 10. So this would be moderate. His treatment, paracetamol, turmeric capsules for his hand pain, and treatments provide 30% relief. The pain interferes with his general activity on a grade of 2 out of 10. It doesn't affect his mood or his walking, only mildly interferes with work, only slightly interferes with relations with other people, and slightly interferes with sleep. So here we have a milder picture in a 67-year-old. But this is encouraging for younger patients who have LDS. It doesn't sound as if fatigue and pain are going to be a large component of their symptom history. So as you can see, we've got some interesting preliminary conclusions, but further work expected, and we'll certainly get back to you with a fuller analysis and pass this on in the form of a publication, because the literature is very sparse to date. And there's a sudden increase in interest in these two symptoms, which are very difficult to treat. They've turned up at the bottom of our list of symptoms. We have good eye care, good spinal care, and so forth, good heart care, but perhaps pain and fatigue need a bit more attention. So we hope to report to you again next year, as Kannan suggests, when we have a fuller analysis and have done some further work. Any quick suggestions or questions from our supporters? If not, if you'd like to send them in, we would be very happy to add them to our work and also answer your question.
I think Noah has found a pen pal, the elusive pen pal. Lovely Amar has said, I'm more than happy for Noah to speak to my son who is 12 and has Marfan.
Excellent, excellent. Well, we were just chatting beforehand and saying if we have a large number of children replying, then they can all form a pen pal and an association and be given a special page in our newsletter. We'll try and catch up with their problems and solutions.
And Amy wonders, out of interest, do you include people with mosaic Marfan syndrome in these studies? I have low-level mosaicism for Marfan's. My son has full Marfan. I'm interested to know whether mosaic cases are studied alongside normal cases.
That's a fascinating concept, and we'll certainly have a look at all the mutations in our study group. This isn't a common presentation, but we would expect some effect, and depending on the proportion of your cells which have the Marfan mutation, and also where they're located in the body. Are they distributed throughout? Are they just in the eye? Are they just in the skin? So maybe we can get back to you. Do you have her contact details, Victoria?
Yes, I believe so. Amy registered for our conference, so yes.
Excellent.
Amy doesn't mind us pursuing this.
We'll get back to you, Amy, but that's a very good suggestion.